Hello everyone, I'm Khwaja Akhtar, a PGY2 in Internal Medicine at OUHSC, and today I'll be talking about a research project which is comparison of clinical and procedural outcomes in transcatheter aortic valve replacement with mechanically expanded valve versus self-expandable valve, and it's a systematic review and meta-analysis. Here is a list of the authors, and the project was directly supervised by Dr. Hawkins and Dr. Rusan from Interventional Cardiology at OUHSC. So transcatheter aortic valve replacement, commonly known as TAVR, has evolved from a novel technology to an established therapy for patients with severe symptomatic aortic valve stenosis. Two commonly used types of TAVR devices are balloon expandable and self-expandable TAVR, which are used in USA. However, these devices have certain limitations, including inability to reposition after implantation, risk of permanent pacemaker implantation, and the risk of post-implant paravalvular leak. Mechanically expandable valve is a third-gen type of TAVR device which was designed to decrease paravalvular leak and has the ability to reposition after deployment. So in this analysis, we have assessed the recent evidence on procedural and clinical outcomes between mechanically expanded and self-expandable TAVR devices. Here is a model of the mechanically expanded valve. It is designed on a braided nitinol frame and comes with an adaptive seal which leads to decreased paravalvular leak post-implantation. And here is a look at the first generation core valve and the second generation Evolute R self-expandable TAVR devices. So the search was performed by two independent researchers on 11th of April 2020, and the search was performed in PubMed and Ovid, and the keywords we used are mechanically expanded, self-expandable, and TAVR, leading to selection of 702 studies initially. After removal of unrelated studies, 22 full-length articles were reviewed, leading to selection of 13 studies which are included in the final analysis. Review Manager was used for statistics, and the results are reported as odds ratio, 95% confidence interval, and p-value. Here is a look at the Prisma flow diagram of our search strategy. So the results showed that the total patient population was 5,043. Self-expandable TAVR was deployed in 3,971 patients, while mechanically expandable TAVR was used in 1,072 patients. A look at the procedural outcomes. TAVR with mechanically expandable valve showed statistically significant decrease in paravalvular leak, post-implant balloon dilatation, need of implantation of more than one valve, and post-implant prosthetic valve regurgitation, and all these p-values were less than 0.05. Peri-procedural myocardial infarction and procedural mortality did not show any statistically significant difference. And a look at clinical outcomes comparing mechanically expandable valve and self-expandable valve showed that TAVR with mechanically expandable valve showed statistically significant increase in need of permanent pacemaker implantation at 30 days and at 1 year interval, and the p-value was less than 0.05. Interestingly, there was a trend towards increased risk of stroke and transient ischemic attacks after implantation with mechanically expandable valve, but the p-value was just at 0.05 and confidence interval did cross 1. 30 days cardiovascular mortality, major complications, and 1 year all-cause mortality did not show any statistically significant difference. Here are the forest plots of procedural outcomes and the clinical outcomes. So after this analysis, we can safely conclude that transcatheter aortic valve replacement with mechanically expanded valve provides better procedural and device outcomes as compared to self-expandable valve. While mechanically expanded valve and self-expandable valve had similar clinical outcomes, patients undergoing TAVR with self-expandable valve had statistically significant decrease in permanent pacemaker implantation. And the TAVR with mechanically expandable valve showed a trend towards increased risk of stroke and TIAs, although the risk was not statistically significant. Here is a list of the references, and any questions can be directed towards my email. And thank you all for a very patient listening.